Adrenaline, a versatile vasoconstrictor and inotropic agent. Adrenaline, also known as epinephrine, is a hormone and medication that acts on the sympathetic nervous system, providing numerous clinical benefits. Adrenaline acts on both alpha and beta receptors, with different effects depending on the receptor type. Effects on the cardiovascular system. Peripheral vasoconstriction. Alpha effect. Adrenaline causes peripheral vasoconstriction, which helps raise blood pressure and improves blood flow back to the heart. Effects on the cardiovascular system. Increased cerebral blood flow. Alpha effect. Adrenaline increases blood flow to the brain, providing additional oxygen and nutrients for brain function. Increased myocardial contractility. Beta 1 effect. Adrenaline enhances the force of heart contractions, helping the heart pump blood more efficiently. Effects on the cardiovascular system. Increased heart rate. Beta 1 effect. Adrenaline increases heart rate, leading to a greater volume of blood pumped out of the heart per minute. Effects on the cardiovascular system. Increased conduction velocity. Beta 1 effect. Adrenaline speeds up the conduction of impulses through the sinoatrial, atrioventricular, and atrioventricular nodes, helping to regulate heart rhythm. Effects on the cardiovascular system. Potential for ventricular fibrillation. Alpha effect. At high doses, adrenaline can induce arrhythmias, leading to dangerous ventricular fibrillation. Effects on the respiratory system. Bronchodilation. Beta 2 effect. Adrenaline helps relax the airways, reducing respiratory obstruction, particularly in cases of asthma or allergic reactions. Effects on the respiratory system. Counteracts the effects of histamine in allergic reactions. Beta 2 effect. Adrenaline helps minimize allergic responses like swelling, itching, and redness caused by histamine. Comparison with other vasoconstrictors and inotropic agents. Adrenaline is a versatile medication with broader clinical benefits compared to other vasoconstrictors and inotropic agents. Phenylephrine acts solely on alpha receptors, lacking effects on beta receptors, thus lacking the ability to dilate airways or reduce allergic responses. Comparison with other vasoconstrictors and inotropic agents. Noradrenaline more potent than adrenaline on alpha receptors but weaker on beta-2 receptors, therefore lacking bronchodilating effects and reduced release of immune mediators. Comparison with other vasoconstrictors and inotropic agents. Dopamine weaker than adrenaline on ALPHA1 and beta-1 receptors, has no effects on beta-2 receptors, and its actions are dose-dependent. Dobutamine and isoproterenol similar effects to adrenaline on beta-1 and beta-2 receptors but weaker or no effects on ALPHA1 receptors. Conclusion. Adrenaline is a versatile vasoconstrictor and inotropic agent, acting on both alpha and beta receptors to raise blood pressure, increase cerebral blood flow, enhance myocardial contractility, dilate airways, and reduce allergic responses. However, adrenaline should be used cautiously due to its potential to induce ventricular fibrillation and other side effects. Important note: adrenaline is a prescription medication and should be used under the supervision of a physician. The dosage and administration of adrenaline need to be adjusted based on the specific situation. Important note: adrenaline may interact with other medications, so it is essential to inform your doctor about all medications you are currently taking. Do not self-administer adrenaline without a doctor's prescription.